just going to briefly mention children. Now, the rules we said within CPR, we've gone through how to do that with an adult. When you're looking at children, they're defined in two groups. There's what we call an infant, which is from birth to 1 year old, and then a child, which is 1 to 18. Now, as far as the basics of them, it's very similar than we do with adult CPR. There's a few little differences. If you're looking at child and infant, we first do 5 rescue breaths. Adults will go straight into compressions, but by doing the 5 rescue breaths, we can flush oxygen into the lungs because it's highly likely in a child or an infant that they are in cardiac arrest because of a respiratory type problem. So by getting air into them really, really quickly, that works. After that, we go to 32, 32. It's exactly the same after that, but the initial bit is the same. The only difference is with the chest compression depth. With adults, we're looking at the 5 to 6 centimeter mark. With children and infant, we say push down 1/3 of the depth of the chest. So that's the basics of it. The only other differences are that maybe with a child, you don't need 2 hands. You could just do it with 1. You can do it with 2 if you want, but you can just do it with 1 hand. And with an infant, even 1 hand might be too much. You can just do it with 2 fingers. So center of the chest, exactly the same place. So if you do need to do CPR on a child or an infant, use the stuff that you've seen on the other videos, but just change the sequence you're doing it. So 5 breaths first, and then 32, 32, 32. And the other final little thing is we've got an infant, squeezing the nose is quite hard. So what you do, because their mouth is very, very small and the nose, you can seal your mouth around their mouth and their nose and blow in both of them. But with a child, you just pinch the nose the same as you would do an adult.